It is something we all have to come to terms with, getting older and looking older. You've heard the saying, aging gracefully.
Some say there's no such thing, and they'll pay good money to stay forever young, or at least younger looking.
WHAS-11's Rachel Platt joins us here tonight at 6 with a very personal story of someone we all know well, and his story of plastic surgery.
Okay, 1, 2, 3.
It's picture day for Reed Yadon in front of the camera, but for a very different reason today.
Look right here at my hand.
These before pictures taken in November, one day before what his doctor calls rejuvenation.
Good morning, Reed.
Good morning.
How you doing?
The day before.
Dr. Jerry O'Daniel specializes in facelifts, nearly 200 of them a year. He's booked through July.
The normal aging process truly is volume loss.
Dr. O'Daniel looking at side-by-side pictures of Reed, the one on the right showing recent weight loss from running. Many facelifts just stretch the skin, not this one.
95% of the surgery still are concentrating on pulling the skin tightly to take the wrinkles out and to reshape the face and flatten
Stretch it.
Stretch it, stretching the skin. We're ignoring the blanket sheets and pillows underneath.
Those pillow sheets and blankets are the bone and muscle Dr. O'Daniel will be working on or near, lifting up what he calls the bedspread.
We're going to lift the skin up so that I have access to the lower, deeper structures.
Pointing to areas he'll refluff with fat cells taken from Reed's stomach, fixing muscles that have fallen.
This is sagging muscle. There's a little bit of fat in here, and not much at all.
More of an artist sculpting than a doctor performing surgery.
Contemporary cosmetic surgery should truly sculpt and reshape the face and the eyes to restore it to where it used to be, not make it look different.
He's been poring over pictures of Reed through the years so he can restore what was.
Certain imperfections that gravity imposes on us all, we can do something about that.
I look like I'm mad, and I'm not mad. So people are trying to change really the adjectives that describe the way they look rather than changing their look in general.
Father time and Reed's time in the helicopter with no sun protection. The mirror becoming more of an enemy than a friend.
It's going to look awesome.
Like Reed, millions of Americans will come into operating rooms just like this one to get plastic surgery. Most of them will be women, about 92%. Men are still in the minority, but their numbers are on the rise.
If someone comes up to me and says, have you had some cosmetic work done or have you had plastic surgery, I'm not going to lie.
Did you have lab work and an EKG done?
Reed letting us get up close and personal like never before. It's the morning of surgery, and Reed's acting more like a reporter than a patient.
What in the world is Reed Yadon doing laying around like this? Find out tonight at 6.
Prep work by the nurses and those markings by Dr. O'Daniel.
So we're going to be restoring volume in your cheek area.
Pluses where he'll add, minuses where he'll take away.
The smaller circles mean it's more concentrated area, and the larger area is going to be less fat added to it.
He marks with Reed sitting up. Things will shift once Reed lays down.
Now the show begins, everybody.
Reed ready for surgery. The drugs kicking in.
I want to dance.
He's wheeled back to the operating room where he will undergo about 5 hours of surgery. 5 hours to turn back the clock about 15 to 20 years.
All right.
We'll be right back after the break.
Sorry, Reed, I had to get the dancing comment in. Feeling no pain right there, is he? Tonight at 11, our cameras are inside the operating room as Reed undergoes, it is major surgery. Is he happy with the results? You're going to find out and get all those before and after
I like
pictures.
him with all the markers on his face.
Well, he said like a pilot, you have your map, and that's what the doctor has when he goes in.
Here's the question I always ask when people bring up plastic surgery, and I see these stars with all this money and all this influence and connections. They look bad. Some of them look bad.
Well, as Dr. O'Daniel said, 95% of the surgeries are stretching. He goes down deep to the muscle and resculpts. And he said that's what you need to do. You need to interview your doctor and say what kind of surgery are you going to do. Also, Dr. O'Daniel will say what you want has to be realistic. He turns people away. If people keep coming back and wanting that over and over again, Dr. O'Daniel would say that's the worst kind of advertising he could have, because you don't want people to notice plastic surgery. It's the surgery that's unseen that he says is the best.
How long do you think it'll last?
A few years. Yeah, several years.
Several years.
Yeah.
All right. Thank you, Rachel.
Thank you very much.
Look
See you
forward
at
to
11.
more on this story
Yes.
tonight at 11, the big reveal on Reed. Let's go to Monty Webb now.